Let's talk about epidurals. Let's open up this training kit and I'll show you what's actually going in your back. Okay, so first things first is we have lidocaine here. Use this to numb up your skin so that when we place the epidural, it doesn't hurt. Don't be scared of this. This is the epidural needle. It goes into place. You won't feel it, and it's not so much about the length as it is about the diameter as far as any sort of pain or discomfort goes, and it's actually not that thick. But this is your epidural needle. This goes in and it lets us place the catheter, which is like a little plastic tube, just like the IV that goes into your arm. So this is the little plastic tube that actually sits in your back. Like I said, it's like a little IV that goes into your arm, and it continuously delivers medication so that you remain comfortable. So once the needle's in place, we take this plastic catheter and we insert it through the needle, and that little plastic tube sits in your back delivering medications. Then we take the needle out, and this plastic thing is the only thing left in your back. The risk for serious complications exists, but it's so rare. The risk for anything like paralysis, I've never seen it, but potentially a risk. It theoretically exists. I know I'm a guy, I know I've never been pregnant, but I have done a lot of epidurals. Epidurals are one of the safest ways to control pain during pregnancy. The benefits is it reduces pain during your labor. Another benefit is that if you have an epidural in place, you have to go for an emergency C-section, it's already there. So that reduces one step in that unfortunate instance where you have to go to a C-section when you didn't desire to. There are risks, though, to every medical procedure that you should be informed of, such as low blood pressure, the risk of what's called a dural puncture headache, and other things like that. If you get a dural puncture headache, it can be like a really bad migraine, but there's treatment for it. It's medications and a procedure that we can do. Overall, epidurals are generally safe and well tolerated. We numb up your back, then we insert a needle, and then through that needle, we put a catheter in. In my recommendation and in my experience, I think the benefits of getting an epidural outweigh the risk. So if you're on the fence about it, talk to your doctor. Additionally, I've seen a lot of family members put undue pressure to avoid an epidural or something like this, kind of boasting, I went natural, you should go all natural. At the end of the day, it's your healthcare and it's your decision. So don't let family members pressure you to go one way or the other. If you want to go natural, go natural. If you want an epidural, don't feel shame about it. Most people get an epidural, and you know what? They usually don't regret it. It feels great.